Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
Hello, my name is Habib Samady. I'm one of the associate editors of JACC Interventions. I'm from Emory University. And it's a great honor and privilege to welcome Dr. Patrick Serruys, who's professor of medicine at Rotterdam in the Netherlands. He'll be publishing a paper in the upcoming issue of JACC Interventions entitled Long-Term Clinical Results Following Left Main Stem Stenting, Insights from Research and T-Search Registries. Dr. Serruys, welcome to JACC Interventions interview.
Thank you, Abby, for having me here. In this paper, we are reviewing the experience between 2000 and 2005, and we start with drug-eluting stent, all comers in 2002. And this is a long follow-up. Median time is 1,400 days, more than 1,400 days. And to summarize what we have observed in these difficult population, I must say that 25% were STEMI patients with main stem, 8% was in cardiogenic shock at entry. Their syntax score was on average 39 and an Euro score of 4.4. So I tell you, a difficult population. And in general, after discussion with the surgeon decided that PCI was a better option than surgery for these patients. That's the type of population that we are describing in this paper. Now, in a nutshell, what we have observed with more than 4 years of follow-up is that patient-oriented outcome, we call that patient-oriented, is all cause of mortality, all myocardial infarction, all revascularization was around 55%, and all cause of mortality was around 35%.
So let me understand, so this is in the drug-eluting stent population, or is this all comers?
No, so it is the first 79 are bare metal stent.
Okay. And
then on April 16, 2002, we shift 100% for drug-eluting stent. First Cypher, that's the research, and then Taxus with the T-search. So that's the population we are talking, describing.
So what was the design, and what did you observe differences between drug-eluting, bare metal, and what was the cumulative event rates over the 4 years?
Right. I mean, what is interesting is that in this case, there was not too much difference between the population prior to 2002 with bare metal stent and after that. So we didn't have to face a complex adjustment of propensity. And one of the message of this paper is that we did somewhat arbitrary landmark analysis after 2 years, and we saw that some of the benefit of the drug-eluting stent disappear between 2 and 4 years of follow-up. And that's something that we have observed now in different populations. Also, we published in JACC in acute myocardial infarction. We saw the initial advantage on TLR and TVR disappearing with time, so that at the end the outcome is very similar between a bare metal stent and drug-eluting stent. It's not a reason not to use it, but certainly there is a phenomenon of erosion that I described recently in GACC in the 5 years follow-up of ARCH2, where we see that slowly the so-called definite, probable, possible stent thrombose creates some phenomenon of erosion, at least with these first generation of stenting.
So with bare metal stents catching up, you think it's predominantly a late, some stent thrombosis relation with drug-eluting stents that create the events, and therefore, and you don't see them as much with bare metal stents late on.
In this study, we relied completely on the Bureau of Statistics of Den Haag. So we are not adjudicating anything. It is done in Den Haag by the Bureau of Statistics using the ICD-10, which is the International Description for Death, Revision 10. In the ARCH2 study, we were really looking at what happens in this patient. And what you say is correct. I mean, the erosion in terms of event is coming for 32% from this problem of stent thrombose, which I hope will be different with the second generation, because we're still talking here Cypher and Taxus.
Okay, so last word, in 2010, if you had to place a drug-eluting stent in the left main, a large 4.0, 4.5 left main, would you put in a drug-eluting or bare metal?
Oh, definitely a drug-eluting stent, and that's what we are going to test again versus surgery in the Excel trial.
Yes.
That we are going to start with Greg Stone, Joe Sabic, and Harry Peter Capitaine before the end of the year.
Fabulous. Well, thank you very much, and it's wonderful to have you in the JACC Interventions studio.
Thank you very much.
Thank you. Thanks for listening.